A wound is defined as a type of injury in which skin is torn, cut, or punctured, an open wound, or where blunt force trauma causes a contusion, a closed wound. Three types of blood vessels in the body that can be damaged during an injury are arteries, veins, and capillaries. Artery wounds are not common as they are deep within the body. Artery wounds are bright red and often spurt with each heartbeat, which makes them difficult to control. Vein injuries are more common. They are dark red and also easier to control. Capillary wounds are extremely common and easy to control as they are under low pressure. Artery wounds are frequently the most serious risk to an injured person's life and require immediate help. To treat an artery wound, start with the acronym AID. A. Activate 911.
Call 911!
I. Inform the victim you are trained and ask for consent. D. Don personal protection equipment. Apply pressure directly on the wound with a clean, sterile bandage. Hold the pressure continuously directly upon the wound. If you do not have a cloth, apply direct pressure with a gloved hand. Maintain this firm pressure for 10 to 15 minutes. In urban areas, emergency medical help will most likely arrive during this process. If EMS does not respond within 10 to 15 minutes, release pressure. If the flow of blood continues, repeat the procedure again by applying direct pressure. Do not remove the gauze or bandage. If the bleeding continues and seeps through the absorbent material, don't remove it. Instead, apply additional absorbent material on top of the first dressing. If you cannot manually apply direct pressure, or if the bleeding subsides, tie the bandage knot directly over the wound. Continue to assess the victim. Assure the bandage is not tied too tightly by checking the fingernail bed. Press on the fingernail bed with light pressure. If the color does not return within 2 seconds, or if the fingers feel cold, loosen the bandage. Treat for shock. Extremities are sometimes subject to amputations. If the fingers, toes, hands, feet, or limbs are completely cut through or torn off, jagged skin and bone edges can sometimes be observed. There may be massive bleeding, or the force that amputates a limb may close off torn blood vessels, limiting the amount of blood. If there is an amputation, by responding quickly, there is a good chance that the severed body part can be reattached. Complete the acronym AID. Control the bleeding by using direct pressure on the wound. Wrap and bandage the wound to prevent bleeding and infection using a clean, sterile cloth. Wrap the severed body part in a clean, sterile dressing. Then place the amputation in a plastic bag. Place the plastic bag on ice to keep it cool, but do not let the body part freeze. Assure that the amputated body part is transported to the hospital with the patient. Treat for shock.